All right, so we are about to do a lip lift, and we've shown a lot of results on lip lifts, but here we're going to go through the evaluation and marking of the lip lift. So one of the criteria for lip lifts is that with age, the distance between the nostril and the lip gets longer. And when that happens, you can create some changes. One is the upper lip becomes a little bit thinner. And the other one is that when the mouth is open, you can't see the top teeth. So as a result, the smile gets affected. It becomes a little bit more sort of dull and more flat. So go ahead and open your mouth for me slightly. So you can see here that the top teeth are completely covering the entire upper teeth here. Open up a little bit more. Go ahead and open up more. And so even with the partially more open, you still can't see it. What we want to see is a slight show of those bottom teeth. We call it frontal tooth show. We want to see it slightly higher. And then this is very hard to emulate with your fingers, how it's going to ultimately look, but that's basically the concept. So in this case, when we measure the distance between the top of the lip and the nostril, you see it's about 20 millimeters. And as we said before, that the distance, the ideal distance is somewhere around 13 to 15, but if we use just numbers as the evaluation, then when we shorten it, she probably will end up showing too much teeth. So despite the fact that she's about 5 to 6 millimeters longer than ideal, we want to be a little bit more conservative in this case because we want to just show just the tips and not the entire front, these two incisors, because their teeth are a little on the longer side. So we'll probably shoot for about 4 millimeters. The incision hides basically underneath the nostril in this nice little groove that's formed between the nostril and the lip. It's hidden in there, and we basically want to keep it in the natural groove so that when the incisions end up healing, you can't see the position of the scar, and we make it just in this hidden right there in that natural crease there. And then from there, we'll measure the appropriate distance, or in this case, it's about 4 millimeters. We take it from all these different positions, and then connect the dots, and then bring it all together. And we're going to get started very soon. And it's a simple procedure we do under local anesthesia. Okay, so here is the incision design. This is what we call a bullhorn incision, and it's shaped like the horns of a bull. But the beauty of it again is that it hides in the natural creases. And you can see here it's about 4 millimeters across the areas, and then it tapers in to the ends of the incision, so it functions as an ellipse. Ultimately, that's about as much skin as going to be removed. Nothing too dramatic in terms of the amount, but just enough to give a little bit of that elevation. And because of the direction of these the excision ellipse, you're going to see all aspects of the lip coming up in a balanced way, and that's one of the things that makes this incision design so natural looking and so effective. All right, well, thank you very much.
Okay.